Thank you so much for being here today. I'm Dr. Melissa Eads from Texas, and I'm going to be talking about, this is kind of one of my favorite subjects as well, bandaging and splinting. So, to kind of give an overview of the lecture today, the first thing I'm going to talk about is why you might need to use a bandage or a splint. And then we are going to talk about how you approach just a basic injured, wounded animal, and what steps you want to take before placing a bandage. And then we're going to talk about different types of bandages and splints and when you might use them. And I'll give a demonstration of how to actually do a soft padded bandage called a modified Robert Jones that you can also incorporate a splint into. And then finally, we'll close up with some pitfalls, some things you want to try to avoid with bandages, and also just some handy tricks that I've learned through the years. All right, so why do you need to use a bandage? Well, first of all, the animal may have a broken bone, a fracture, and that's going to need stabilization to heal, and that would be a splint bandage. And we'll talk about specific types of fractures that you want to use splints with. There's some that are just not going to work very well if you try to use a splint for those. Also, if a pet has a dislocated joint, typically a shoulder, an elbow, a hip, then after you're able to get that joint back into place, you can place a bandage that's going to keep the joint in place while the joint capsule heals. And then also, if there is a healing incision, we often use bandages if we have done a surgery, and maybe it's just an area that didn't have a lot of skin to close and it's under a lot of tension. Then a bandage can kind of help that keep the limb still. So while that skin is healing back together, it's also going to protect against the animal chewing at the wound, licking at the wound, causing further damage to the wound. You may also need, we call them Elizabethan collars, the cones on the pet's head to keep them from chewing at the bandage, because they can get these off. Even the best placed bandage can be bitten off by a dog. We want to protect against further infection from the environment, and again, from the pet licking it or maybe another pet licking at the bandage. And also just from further injury, whether it's from chewing or it rubbing up against something, just kind of constantly being touched by things in the environment. We want to avoid that. There are some situations where we would use a bandage to apply pressure. If the animal has a gushing, bleeding wound, and kind of in an emergency situation, we want to stop that bleeding, you can apply a quick bandage until you're able to get the pet to a different location, or get it sedated so you can tie off the vessel that's bleeding, something like that. Also, in dogs that have a hemoabdomen, so that's blood bleeding into their abdomen, maybe from a ruptured splenic mass or liver mass, or low platelets, and they just started bleeding into their abdomen. You can do a a belly band. It's like a compression bandage around their abdomen, to try to get that to kind of stop bleeding potentially. It's minimal effectiveness, but it's something that you can do. Obviously, you want to make sure it's not too tight, not restricting breathing or anything like that, but that, could help a little bit, especially if the pet is getting transferred somewhere, and it's more of like a short-term fix. And then you can also use it for swelling, for edema of a limb. I have not personally used it for that situation, but that is listed as one of the uses of bandages. And then also it's going to provide comfort, not only for fractures. I mean, that definitely, you're going to keep that limb immobilized. You're going to keep it still and from moving. But even with just a wound that does not have a broken bone, it does make the pet more comfortable just to have that kind of compressed a little bit, and they don't have to worry about hitting it, banging it on things. And then finally, I'm going to talk a little bit about some special bandages that we can use that are actually of medical use to debride the wound, which is pulling off or the dead tissue, the exudate, which is like all that pussy kind of sticky liquid that oozes out of the wound. There's some wet to dry bandages that we can use that will actually help debride that wound. And then there is also a sugar bandage. And some people use honey. I'll talk about that a little bit later, but those have some antimicrobial effects where they can actually, fight off some bacteria. The sugar creates an environment that's really good for promoting new tissue coming in and killing off that bacteria. So, there it goes. Okay. So now we are going to talk a little bit about how to categorize a wound. And the first way that you can categorize a wound is by how contaminated or infected it is. And so that first category is called a clean wound. And that is literally just a surgical incision. And so there's not really any bacterial contamination. We've cleaned the area before we've done the surgery, which is, hopefully rid the area of any contamination. And so that would be more the category of a surgery, maybe a mass removal or something like that. It's still considered a wound, even though we created the wound, but they still categorize it as a wound, a surgical incision. Then there is a clean contaminated wound, which is just very minimal bacteria or contamination. This might be if the pet, lacerated its paw on something that was very clean, some metal or something that was not really in a contaminated area. And then there is kind of our basic wound is a contaminated. That means that you know that there's going to be some bacteria in there. It hasn't really started to fester and grow a lot of pus, but that, this could be a bite wound early on if it just happened, any kind of laceration or cut that, occurred in just a typical environment. And maybe also you see some dirt in there and things like that. And then the last category of by contamination level is a dirty or infected wound. And this one, the infection has already set in. And these are these older wounds that we see. Maybe the owner tried to treat it at home and were unsuccessful, or they couldn't get to a veterinarian. And so you're going to see some pus there. You may see some dead tissue. It may be kind of black or purple. And so that's what we're going to call a dirty wound. And then we can also categorize wounds by what type of injury occurred. An abrasion is going to be very superficial, so just skin and maybe a little bit of sub-Q. Then there's a laceration, which is a cut, and you can have a superficial laceration, or you can also have a deep laceration that's going into muscle, vessels, nerves, things like that. And then there's something called an avulsion injury, which is where you have a flap of skin. You know, it may have been a laceration and now you just have kind of a flap of skin hanging there. And then in a severe situation, a lot of times we see it in the bottom part of the limb. There can have a degloving injury, which is where like the whole skin pretty much just comes off like a glove and it's just all exposed underlying tissue. Those are not fun to deal with, but can have some success there sometimes. And some of these more extensive injuries where there's a lot of skin missing, sometimes we'll do a skin flap. I'm not going to go into too much detail on that, but basically you can kind of take some healthy skin and not cut it completely away, but leave it attached in one area and just rotate it to cover the large wound that is there. And then you can have a puncture injury. We see these all the time. Bite wounds, sometimes from another pet in the household, sometimes from an animal, another neighborhood dog or cat. And it's going to be just those pinpoint entry wounds through the skin. But most of the time, even though the damage looks very small on the outside, there can be a large hole right underneath those teeth marks, those puncture holes. Because basically as the animal bites, the damage is going to kind of be all on the inside and it separates the skin from the underlying tissue. And so we a lot of times need to place drains in these kinds of wounds so that way it can heal underneath. If you just close a puncture wound, then you're going to have a huge hole underneath that closure, and bacteria is probably going to be trapped in there. You could easily get an abscess. And then even if not bacteria, sometimes just fluid will accumulate underneath there and you can get a seroma or hematoma, and that's going to delay healing. So if there's much of any damage underneath the skin, we can place a drain for about 5 days so that can heal underneath first. And then once we feel like it's healed, we'll pull the drain and then it just kind of finishes healing up the rest of the way. And then the last type of injury is a crushing injury. That would be pressure. An animal gets hit by a car or gets, crushed underneath something. And there can be a lot of damage to the bones and the underlying tissue. There may not even be a wound on the outside. It may just be bruising. So those are all of our different categories. And now I want to talk about what you do when you have an animal that has a wound come to you. So first of all, we always want to jump straight to, I'm sorry, I don't know how that happened there. But first of all, you want to assess your patient. You want to make sure that the pet is not losing a lot of blood. You want to make sure that they are breathing, the right amount, take their pulse, basically just make sure that, they're going to survive you attending to the wound. So always look at the patient first, because sometimes they can have a glaring wound that you just want to get to, but you need to make sure that they're going to be okay. So stabilize the patient, and then you can go ahead and look at the wound and kind of see what you're dealing with. Is this superficial? Is it deep? You know, just on basic a look. And then you're going to want to make the pet comfortable, so that way you can properly attend to the wound, if at all possible. I know a lot of y'all may be working in not ideal situations, but if you can give them some kind of pain medication, that's going to help you greatly. And then most of the time we are looking at sedating these animals if they are healthy enough to have sedation. A lot of times we will use an opioid type medication like a butorphanol or hydromorphine, and then pair that with a sedative agent like ace-promazine or dexdomitor. I don't know exactly what y'all have, but that's just kind of our kind of sedation protocol there. Sometimes we put them under complete anesthesia if it looks really bad and we feel like they'll be most comfortable with that. And so then once you have them stable and sedated, then you're going to approach your wound and you want to clip away all of the hair and clean the wound. And there is a little handy trick that I learned. If you have any sterile lubricant with you, then you can actually just put that straight into the wound before you shave the hair. And that will actually keep the hair from getting in the wound. So you put that sterile lubricant in there and then take your clippers or your shavers and just shave all the way around, get all that hair off. And then you can go ahead and clean the wound. And I have another slide about different types of solutions that we use. A lot of times if it's more superficial, say it's just something called a moist pyoderma or a hot spot, you know, if the animal's been itching a lot and it's created an infection, then we'll clip that and we'll scrub it with chlorhexidine scrub. If the wound is a little bit deeper, then we want to do something called lavage. And that's where you're really just getting rid of the visible dirt and things like that that could be in this wound. And you can use just basic water. If it's already, you know, contaminated, it's a bite wound and it already has a bunch of bacteria in there, you're not going to hurt it by just doing some water on it. You can sometimes do a little bit of pressure with the water and that'll help kind of get off the dirt and the hair that's probably still in there. And then if it doesn't look that dirty, then we like to use sterile saline or dilute chlorhexidine solution to kind of lavage underneath the skin as well. And sometimes I'll use a syringe. And so I'll just pull up the sterile saline or the dilute chlorhexidine in a syringe and just kind of squirt it into the wound, especially if it's those puncture wounds. You can just stick that syringe in there and squirt it, and probably do that about 20 times. Just kind of get all that out of there. And then you want to probe the wound. So if you have a sterile surgical instrument with you, like a hemostat or something like that, then just stick it in the hole and move it around and see how far the damage goes. If the hemostat goes all the way into where you put your fingers in, then, you know, you have damage this far underneath the skin. And so you're going to probe around, and then we want to freshen the edges if it is an old wound, because if you try to just suture together two pieces of dead tissue, it's not going to work very well. So say you have, you know, a circular laceration, then you're just going to take some sterile scissors, Metzenbaum scissors or something like that, and just kind of cut all the way around until you see the edge bleeding just a little bit. And then, you know, you have fresh tissue. You may have one of those avulsion skin lesions where there's a flap of skin. And so you may need to to cut off any dead tissue there. And then if you can, you want to try to close the wound with suture. Sometimes we cannot do that. And so that's when we're left with an open wound is what we call that. And we have to let it granulate in, which is where the body just is going to generate granulation tissue, healing tissue, and then eventually the skin will hopefully, grow over that. And then you want to close dead space with a drain. So place a Penrose drain, which is like a sterile rubber tube, and you suture it on the top. So it's in place, and then you kind of have a little hole for it at the bottom through the skin, and it's just going to drain fluid for about 5 days. And then of course we want to bandage. We're talking about bandaging today. And then after you have woken up the pet and everything, you want to make sure that you treat the animal. If possible, you want to give them antibiotics to either prevent infection or treat an infection that's already there. Pain medication, anti-inflammatory medication, that would be like an NSAID. We use carprofen here. There's also another one called meloxicam. Things like that. And then just basic other pain medication, opioid type medication. So, all right, types of cleaning solutions. So I didn't know exactly what y'all, had available, but you can make a dilute chlorhexidine solution if you have, we want it to be this 0.05% solution. If you have it more concentrated than that, then it can actually damage tissues. And same for the iodine solution. So diluting it out is very important. And so if you have just basic chlorhexidine stock, it's a kind of a medium blue color solution, then you would take that and you would dilute it 1 part of the solution to 40 parts sterile saline, or if you don't have it, just water. And then same for the iodine. You really want this 0.1% solution. And so you would take this typical 10% stock, like you just look at your iodine and see what percentage it is. And hopefully it's that 10% stock solution. And you're going to take 1 part of the iodine and 100 parts of water or sterile saline if you have that. And then you're going to use that solution to lavage the wounds that you're going to use your syringe and put inside there. And also just kind of a little trick that someone told me along the way, say you were kind of in an emergency situation and you don't have time to measure out 1 part of this, 100 part of that. The iodine solution should look like kind of weak tea is what they said. So you want it to have that color of, just really light brown, like a tea color. And then I did want to mention hydrogen peroxide. A lot of people think that this is a good thing to use, and it's really not very good for tissue underneath the skin. It can actually damage the tissue again. And also it just doesn't work very well against killing bacteria and things like that. So, all right, so now we're going to get to our bandages, and I wanted to just talk about the different typical layers that you would have in a bandage. The first layer is kind of the dressing that is going to be applied directly over the wound. And sometimes it will be adherent, which means it's going to stick to the wound. That's going to be like our wet to dry bandages or wet to wet bandages. Or you can have a non-adherent layer, and that's going to be maybe you put some ointment on a gauze so it doesn't, really stick when you take it off. Or we actually have a product called a Telfa pad, in the United States, which is kind of like a glossy gauze that just doesn't stick. It doesn't pull away tissue whenever you remove it. The second layer is going to be padding. And depending on where the bandage is, depending on what kind of bandage you're using, you'll have different levels of padding. The third layer is going to be the stability layer or the conforming layer. So you want to keep all that padding in place. And so a lot of times we use like a stronger gauze, roll gauze to do this, and you may also put in a splint at this point. And then the fourth layer is what you're going to use, just kind of that outer protective layer for your bandage. And so the different types of bandages we're going to talk about today are wet to dry, dry to dry, sugar bandages, modified Robert Jones bandage, and a tie over bandage. Okay, so a wet to dry bandage. This is one that you are going to want to use if you have a wound that is infected and it has a lot of yucky, just gross tissue that you want to get off of there. You want that good, healthy, fresh granulation tissue. So this bandage is actually going to help you. So, it's going to be debriding the wound each time you change it. These do need to be changed daily. You cannot put this kind of bandage on and leave it for more than a day, or it's going to do more harm than good, because it's just going to cause, you want to take off that infection as you change the bandage. You don't want it to fester underneath there. And so this would be for an initially contaminated wound. And once you have good granulation tissue, a healthy wound, then you're going to switch to a different kind. You don't want to keep doing this just kind of for the initial, typically like maybe 5 days. And so how you would apply this is for that initial layer, that first layer that's going to be touching the wound, you want to just take some gauze and spray some saline on it, and then just put that directly on the wound. Then you'll do your padding layer, your conforming layer with the roll gauze, and your protective layer. We use vet wrap. I'll show that to you in a minute here. And so what you're going to see when you start to do these bandages, after it's been there a little while, you will typically see something called strike through. And that is when the outside of the bandage starts to see little wet spots. And that means that the liquid has gone all the way from where the wound is and soaked through all those layers to the very outer layer. And that's typically when you want to change it. And that's about in 1 day, you'll see that happen. And what's actually happening is because, liquid likes to wick through these different materials. It's actually pulling things through to the outside of the bandage. And as it's pulling the liquid, it's also pulling the infection and pulling all those, those layers, those initial layers of the wound. And so that's why it's kind of, when you go to take it off, it's going to take that yuckiness with it. And so just a little note here, a dry to dry bandage is the same pretty much as a wet to dry bandage, but basically the wound is so goopy and wet and kind of slimy that you don't even need to put saline on the gauze. You can just put dry gauze on there and it's going to be so wet that it just is still going to pull it out and seep out to the outside of the bandage. And so here is some images of how somebody successfully used one of these wet to dry bandages. You can see in the before picture that there is some exposed muscle and tendons there. And so they use this, and now on the after picture, you have that really nice kind of bright pink red tissue that is going to be the good granulation tissue. And so at that point, you could switch to a soft padded bandage. You don't need to use the wet to dry. So now I'm going to talk about a sugar bandage. And so it's kind of similar to the wet to dry. You don't actually have to wet the sugar, but as you add sugar to a wound, it's going to kind of make it almost like a paste. And so you would use this in a really large contaminated wound. The sugar creates an environment that the bacteria do not like. So it's bactericidal. And then it also draws macrophages, which are the healing white blood cells, to the area. They kind of do all the cleanup, eating away at the dead tissue. And then it's going to decrease edema and help form that pink healthy granulation tissue. And these do need to be changed when they become wet on the outside, that strike through that we talked about. And it's, again, typically once a day. So, I mean, on that picture that I showed you before, I guess that one probably didn't have quite enough contamination to maybe use a sugar bandage. I don't think it would hurt anything, but you could. And so basically how you apply this is you'll clean and lavage the wound, and then you just pour sugar directly on that wound, and then do a bandage with dry gauze, roll cotton, roll gauze, and vet wrap, and secure it with the tape and elasticon. I did want to mention here that some people use honey. It was stated that you don't want to probably use just basic honey that you would find. There's like a medical grade honey that they use for these wounds. So, you know, I don't know how it would do with just basic honey that you had, you know, laying around somewhere. This sugar bandage is just basic sugar. There's no, it can be cane sugar, and, you know, it can be any kind of basic sugar. So, but the honey, it was a little bit more specific. They recommended only using medical grade honey. Okay. And so now we're going to talk about a modified Robert Jones. This is the bread and butter of bandaging for us most of the time here. After you've done maybe a wet to dry bandage, after you have healthy granulation tissue, this is what you're going to put on to just protect that wound while it continues to heal until the skin is all the way over it. And you can leave these on for much longer. So it usually lasts about 3 to 7 days. Again, you want to make sure that it doesn't smell bad, that it didn't get wet from the pet, you know, walking somewhere that was wet. You don't want to see any strike through. You'd want to change it earlier if you did see that. But these ones are going to last a little bit longer. And these are the ones that you can actually put a splint into to help stabilize if they have a fracture. And then for this kind of bandage, what you're going to do is do tape for stirrups. You'll do an initial layer of hopefully a non-adherent, you don't want it to stick to the wound at this point, because you want those skin cells to be able to kind of grow over the wound. And you don't want to pull those away every time you change it. And then, so you'll have hopefully a non-adherent. Again, if you just have basic gauze, you can just use kind of some ointment. Maybe if you just even have sterile lubricant or something, or antibiotic ointment. We use mupirocin. We use silver sulfadiazine. You could even potentially use just like a neosporin or something if you had that. And then put the gauze. And then the next layer is going to be cotton roll or cast padding. The third layer will be roll gauze plus or minus a splint. And then the fourth layer will be vet wrap. And then we'll secure it on the top and the bottom with elasticon. And so now I wanted to actually do a bandage demonstration for y'all. So I'm just going to stop the presentation for just a second and move to a little area where I have set up for a bandage demonstration. Okay, so this is our animal leg for the day. This is a dog hind leg. And so you can see here's the hock and here's the toes. And so hopefully you can see here what I'm doing. But so I wanted to start with doing something called stirrups. And this is going to keep the bandage in place much longer than if you don't. It kind of stops it from slipping off of the leg. And so you'll take just some basic tape here, and you want it to be, you know, go up maybe 2/3 of the way to the hock, and then you want it to go a little bit past it as well. So about that length. And then a lot of times you can either do a whole piece of tape, or I will actually rip this in half. And then you do it, you're gonna place one all the way down like that. And then this is a handy trick for the stirrups. You're gonna take a tongue depressor, or just any flat piece of wood, popsicle stick or anything like that. And you're gonna put your piece of tape onto that kind of comes out past the leg. So we have some tape on the leg and some tape on the popsicle stick, and then you're going to do one on the other side as well. Again, this is called tape stirrups. All right. Okay. And so then you're going to apply your initial layer here. This is the Telfa pad that I was talking about. It's kind of shiny and smooth. And you could put ointment directly on that, or you can just use basic gauze. And so we'll pretend that our wound is kind of right on top right here. And so you'll want to cover that. And then you're going to take, this is roll cotton. You can also use cast padding. It's just really fluffy and soft. And the way I was taught, you can kind of unroll things two ways. You can kind of try to wrap like that. I was always taught to unwrap it this way. So your little tail here, you want to kind of be rolling away from yourself. And so you don't really have to worry about this layer being too tight. It's so soft that it's not going to really compress. It's not our compression layer. So you can, you know, wrap this pretty tight. And so you'll just kind of, you also always want to start at the toe. You wouldn't want to start up here and go down. That's how you can have swelling of the toes. You kind of want to pull any swelling away from, any pressure away from the toes, because if you place a bandage that is too tight, you're going to have a lot of problems. And we'll talk about that a little bit later too. But starting at the toe is always where you want to start. And so you'll just kind of just start bandaging. And I was always taught to do about, cover about half of that layer right there. So, I mean, I could, you know, cover just a little bit, but you want to cover about half.
Sir, thank you, sir.
Covering about halfway each time. And then you want to come back down. And if this was a real bandage, I'd probably do 2 layers of this. This is a lot of. You also want to be careful with the joints. So or if you're dealing with the elbow and a front leg, you probably want a little extra padding there, just to make sure that it's there's not pressure on those when they lay on the leg, and also when you put your splint on. And so you start at the bottom, go up, come back down, and then we could do that again if we needed to. And then you have your conforming layer. And so this is called roll gauze. And so this is where, again, you don't want to do it too tight, just medium pressure. I know it's really hard to explain over the internet, but you know, just, you want it to be tight enough that's going to stay in place, but you don't want it to be too tight. And again, you'll just start at the bottom here. And just really what this is doing is you're just holding the padding layer in place. And so again, I'm just covering about half of that first wrap around. I'm going to cover that about halfway. And then you can come back down. Hopefully your animal is anesthetized or sedated and being held by a technician. All right. And then I do typically tape this in place because I don't want it to just start unraveling before I do my next layer. So just one little kind of piece of tape right there. And then if you wanted to apply a splint, if there was a fracture, this is when you are going to apply a splint. This is a clear plastic splint that we can just purchase. You just have to do what you can. If you have a piece of bamboo or an aluminum rod, those can work as well. This one actually goes, you know, right along this side of the leg. It's kind of hard to see because it's clear, but so you would put that in there, put that against the leg, and then you want to secure that in place. And we have this really awesome product called vet wrap or cling wrap. And this one, you also have to be very careful. It can tighten. And so one trick that someone taught me is that you can kind of unwrap it first and then kind of gently roll it. So that way, when you go to bandage, you're not pulling too tight and wrapping it around. The padding is supposed to be helping for that, you know, not compressing too much. But I don't know what, you know, materials you may have at that moment. It may just be something like just a basic ACE bandage or something that you need to wrap around the outside of this to keep it in place. But again, this one you'll start, I do like to leave some of the toe exposed. You don't want to actually wrap all the way and cover all the toes. You want to just kind of leave a little bit of the toe exposed. And then again, you're kind of unrolling it away from you. And then you'll just, so I'll kind of pull it and then just place it on there. And this is going to keep that splint in place and just protect the bandage. And pretty much for all these layers, go all the way up and then come back down. This one didn't quite make it all the way down. And then this product actually sticks to itself. But you may want to add a little piece of tape wherever it ends. Like that. And then we'll do our stirrups here. And so, and you can actually do this before the final layer as well. It doesn't really matter. So you're going to take the sticky part of the tape was attached to this stick right here. And so I'm going to just kind of twist it right there. And then you're going to lay it flat on the bandage like that. So it's sticking to the bandage. And then the same for the other side. Peel it off the stick, twist it, and then stick it to the bandage. Again, that's just going to keep it from slipping down. I'm tugging on this pretty hard and it's It's not going anywhere. So it's like, we call them little stirrup straps. And then I like to also kind of secure and protect the top and bottom of the bandage. And we have a product called Elasticon that's just really sticky bandage material. And so I like to use this on the bottom here. Again, you're leaving the toe, the middle two toes exposed. It's okay if the outer toes are covered. So I'd probably go around this twice. And this material is actually very hard to tear. And I don't have my scissors with me. I forgot my bandage scissors, but you'd want to cut this with scissors and then kind of tuck it in around the edges. And then you would do the same just one time around at the top. And then one other thing I wanted to show you is, say we have two little dog toes sticking out of the bottom of this bandage here. A really good idea is to take a tongue depressor. You can even take a piece of paper, doesn't matter, anything that you can write on. And you want to mark where that second and third digit are, where the little claws are sticking out. So you can see my little marks there. And so basically that's a way that you can evaluate for swelling. If the toes begin to get swollen, they're going to start separating, and this mark is the toenails are going to be further out than where this mark is. So you can give this to the owner and say, if the toes are not lined up with these two marks, then you need to come back or give me a call. So that's another handy trick that you can evaluate for swelling. All right, I'm going to go back and we'll continue our presentation. All right. All right, so the next type of bandage that I wanted to discuss is a tie over bandage. And these are very helpful if you have a place that's just really hard to bandage. The bandage keeps slipping off. You really just need it in one spot. This picture here is a perfect example on a hip on an animal. And so you actually place sutures. You make kind of like just a loose suture, and then you can tie umbilical tape to those sutures that are all the way around the wound. And it's just going to kind of hold it in place. And so you place these sutures, and then you would want to put an initial layer like gauze or the non-adherent Telfa pad. You want to make sure it's really padded. So a big thick pile of gauze on top of that. And then you can use umbilical tape, shoestrings, anything to just kind of take, put through one loop of the suture and then go across and put it through the other loop. And there's just, you know, a bunch of those that are kind of holding it down in place. Okay, so now we're going to talk a little bit about splinting. You can see in this picture a little bit better those plastic splints that we use. They're different for the front leg versus the back leg, and they also come in various sizes because dogs can be lots of different sizes. So if you were going to use something like that, you'd want to make sure it's the right size. You can also make your own with, if you have the product that it kind of turns into a cast once you get it wet. You don't have to go all the way around the leg. You can just use that casting product and kind of just go back and forth and make your own splint that's conformed exactly to that pet's leg. And then let it dry and it'll become hard. And you could use that for a splint. You want to make sure that the animal is kind of in a natural, relaxed position. You don't want it like super flexed or extended, just kind of a natural flexion and extension, just like this picture shows. Okay, so if we have a fracture, which ones can we actually be successful with splinting and healing this fracture? Well, first of all, it can't be an open wound. If you have a piece of bone sticking out of your hole right there, really, if you have any kind of damage to the skin, then it's not going to typically go well. I mean, if there's no other option, then you can try and just really make sure you do broad spectrum antibiotics and stuff, but just in general, it's not very successful. Typically the bone is going to get really infected, and it's not going to want to heal if it's infected. So you would want it to be a closed fracture, which means there's no damage to the skin. It's just kind of all in that bone, or no hole in the skin, I guess, no laceration or anything like that. You want to make sure that it is reducible, which means that it can like actually touch back together a little bit. If the bone parts, after you maybe take an x-ray or palpate, they're really far apart and they won't come back together, that's going to be a lot of area that those bones are going to try to heal, back together, and it's just not going to work very well. So you want about 50% of the bone touching each other. And the best kind of fracture for splinting is called a simple transverse fracture. If you look at this picture here, it's that second one on the top row. It's just like one little fracture across. And you do not want to use it for an oblique or a comminuted fracture. So an oblique fracture or a spiral fracture is where it's diagonal, kind of going up and down. And what can happen is those diagonal pieces will just kind of go over each other, and then the bone will be a lot shortened, and they may have like a shearing effect, and it just doesn't work very well for a splint. Really, those need to be have surgery, plated or pinned. Again, if you don't have those options, you can try, but it's just probably not going to work very well. And then a comminuted fracture is just where there's tons of little pieces all in there. It's not just one straight across cut. And then you need to be able to immobilize or, keep still the joints above and below the fracture. So a lot of times we'll use them on a radius or ulna fracture, because we can easily keep the elbow from moving and keep the carpus from moving. Or maybe on a back leg, one that's on the tibia, you could use that for. But if it's a fracture that's higher up, like a humerus or a femur fracture, those are going to be really hard to heal with just basic splinting. You could also do like carpal fractures, because you can kind of stabilize that bottom part, carpal or tarsus fractures, because you can kind of stabilize the bottom part there. And then ideally you want to do this in a young, healthy patient. Old animals, their bones do not heal very well or very quickly. And you want to make sure that there's limited soft tissue injury. If it's like a crushing wound and it's just totally swollen, and a lot of soft tissue damage, is going to be hard to heal. And then, like I said, kind of below the elbow, below the knee joint would work. And then you need to think about the owner and the animal. If this is a crazy animal that just will not sit still at all, it's going to try to chew off its bandage every day, this just may not be the route to go. Or if the owners just are kind of neglectful and they're not really willing to do the bandage changes and the splinting changes, sometimes you can just make things worse if you don't do it the right way. That's very true with bandaging and splinting. And then just kind of a side note, there's been some studies that if you try to do this on a toy breed, even if it's a young puppy and it's just a little transverse radius ulna fracture, they just don't heal well in that area for some reason. So just something with that breed. So if it's a really, really small toy breed, toy poodle, Yorkie, Chihuahua, something like that, I would say probably below 8 pounds, then it's probably not going to work very well for that area. Okay, so there's some rules for splinting. Again, we don't want to make things worse. So the pet does need to be confined. You can't let them just walk around, do whatever they want with this splint on. So they need to be in a cage or in a small room. You don't want them to be jumping around. You don't want them to be running. Kind of like I discussed when we did the demonstration, the bandage should always start at the toes and then go up and come back down. And then this is another good point. The cast or splinting material should not touch the skin. It will rub and it will cause, discomfort and damage to the skin. So a lot of times with that kind of peach colored elasticon, it's really, really sticky bandage material, I'll like cover kind of the top of the splint with that material, or just make sure your padding goes up past where the splint would touch the skin. So, or where it would come in contact with that skin. So it's protected there. Use the stirrups, the tape stirrups, like we talked about, so it doesn't slide off. And then you have to monitor these, give them the stick with the little marks for the toes, make sure there's not swelling. And it's going to need to be changed anytime there is a bad smell, strike through, which is like where wetness is coming through the bandage, or slippage. I did want to mention just some slings that are used sometimes. This is one that we really just don't recommend using. It's called an Ehmer Sling, and it's supposed to keep a dislocated hip and joint after it's been put back in place. After it's been reduced, which you would want to sedate the animal and you can like manipulate it back into place. We used to use these to try to keep the pet from, using its hip, but they just never seem to work very well. They tend to have more problems than it would do good. You can see this picture on the far right there. That just is, that damage was all done by the sling. That pet had a normal, healthy paw, but the bandage ate into its paw and just caused all that trauma. So another option that you can do if you have a dislocated hip and you get it back in place is just to keep the pet really, really confined. So crate rest them. So put them in a very small kennel where they can really just barely move around, and sling walk them for when they need to use the restroom. So use a towel or something underneath their belly and kind of so they can't put a whole lot of weight on that leg, and help them go out to the bathroom. Or you can do something called a body sling, which is where you kind of tuck up the paw and just kind of wrap it all the way around, not doing this crazy Ehmer Sling situation. A Spica splint is for after you've reduced an elbow flexation. And so basically it's kind of just keeping them from flexing or extending the elbow very much. And you would want to use this, you wouldn't want to use it for a really long time, because then their muscles can start to contract in that position. And then they can, once a muscle's been contracted, it's really hard to loosen it up again. And basically you would just do a soft padded bandage like I showed you, but then the top part of it goes around the chest and the abdomen in the shoulder area. And then this is called a Velpo sling. This one is going to keep the shoulder in place. We don't have as many problems with this one as with the Ehmer sling, so I still think it's okay to use. But again, you just want to be really, really cautious to make sure you do it the right way and don't cause more damage. But basically, you're just going to do a lot of that soft padded material around the carpus and the metacarpals, and then kind of you're just wrapping the arm close to the body wall so it can't move its shoulder around. And then you would do like another layer over that to kind of secure it. And you can also use it for scapular fractures. And now we're going to just reiterate a few things, talk about some things we want to avoid, some pitfalls, and again, some handy tricks. Okay, so I don't think I can emphasize this enough. Bandages can cause huge problems. If they are too tight, if they aren't changed regularly, you're just gonna have more problems. We have had, we've had a handful of pets that have had problems from bandages because the owners didn't come back. They didn't monitor them correctly. Luckily, we've been able to, have successful outcomes by bandaging them appropriately to treat the wound. But, animals have lost their lives and lost their legs to bad bandages. So you can get pressure sores if you don't put enough padding over the bony prominences. So the elbows, the knees, you need to make sure those are really covered well with a lot of padding. You can also have sloughing if the bandage is too tight. And that's that lower picture there, that pet lost 2 toes there because the bandage was too tight, and the body just, the tissue just dies because it doesn't have the circulation it needs. And then just another thing to point out, you can have non-union fractures, like say you're splinting something and it's, it may just not heal back together. That can be a complication there. And then some tricks, using the tongue depressor, that wooden stick, to mark the toenail distances with a marker so you can monitor that. You could actually write on the bandage itself when they need to come back to get it changed. You can use an old IV bag or any kind of waterproof plastic bag to put over the bottom of the bandage if it's wet outside and they need to take the pet outside. Use an e-collar, the cone. Make sure that the pet does not, do damage to all your hard work of that bandage that you put on there. Pre-stretch the vet wrap or the elasticon. That's kind of where I would unroll it and then roll it back up so I don't have quite as much pressure on it when I'm wrapping it, so it's not quite as tight. Do not let the owners bandage. We've had lots of owners that are, in the medical field and they want to do their own pet's bandage. And I just really say, I really do not recommend that because, there can be a lot of problems where they don't understand what's too tight. They don't know about all the layering, the padding and things like that. And then finally, just one little trick that you can have in your back pocket that I've had some success with is kind of similar to the sugar. If you have a wound that you want that healthy granulation tissue to come in, you can use silver sulfadiazine cream and add insulin to it. You would take just basic Humulin in or any kind of insulin like that and add about, I want to say it's about 50 units to a whole cream of insulin, a whole little thing of the SSD cream, and you kind of mix it up. And then it's almost like a paste, and you just put that over the wound and then bandage it. And that just is supposed to help have some granulation tissue grow in it, kind of promotes it, kind of like the sugar. And that is all I have for now. So I'd be happy to answer any questions. I'm going to try to get the chat box up here so I can see what we have going on. Okay. And I'll just start at the beginning and kind of answer some of these that are in the chat box already. What are open and closed wounds? When to let it open wounds and when to close wounds? Okay, so you can talk about an open or closed fracture. An open fracture is where the skin is penetrated. And so those ones you're going to need to treat typically with surgery, a plate and screws. And then a closed fracture is when the skin is intact. But I think you're talking about just like when to leave wounds unbandaged. And you can do that, especially if it's more of just like an abrasion. If the owners, if you know it's not going to continue to get contaminated, the pet isn't going to look at it and chew at it. Sometimes we also do lavage in between bandage changes or daily, just like water lavage. We just have the owner take like a hose, and you want like about medium pressure and just kind of spray it down. We call it hydrotherapy. Sometimes when we do that in between bandage changes, the thing is you need to make sure that the limb is dry before you apply a new bandage. You can just, dry it off, let it air dry for a few minutes. Also about when to like leave an incision open or closed. That's just going to depend on how much tension is on the skin. Sometimes you can close the top and the bottom, and there's going to be a little bit of tissue in between exposed, and you're going to have to let that granulate in. Sometimes you close it all the way, and then it dehisces and comes apart, and you still have to let it granulate in. So that just depends on how much skin you have and how much tension is there. How will you anesthetize traumatized animal if animal was fed? Sometimes you just have to do what you have to do. I will say we use a medication called hydromorphine, and actually that makes them vomit. And so sometimes that's good because it gets out whatever they ate before we anesthetize them. The other thing is, if you were worried about it, you could, instead of just sedating them, you could actually anesthetize them with the tube, the endotracheal tube in, and that'll provide some protection against them aspirating. If they vomited under anesthesia and you have that tube in, it's protecting the airway so that vomit doesn't go into their lungs and cause aspiration pneumonia. So you could just, do that and then really monitor them really closely when they're waking up, and don't pull that tube out until they can swallow fully. We typically wait till they swallow twice. You could wait a few more times. Okay, let's see what type of wounds do you recommend chlorhexidine gauze bandage? So chlorhexidine is more of like the cleaning agent. I don't ever just like leave that in a bandage. We use chlorhexidine. You can use it for any wound, really. The dilute chlorhexidine lavage solution, you can lavage it with that. As far as like the pink kind of scrub is what we use as a, when we're prepping for surgery, we use that. And then we also use that for more just abrasions, which is just kind of the skin, and it looks a little infected because it's good for treating like skin infections and stuff like that. But if it's going into the deeper tissues, if it's not just like a skin abrasion, then I try to avoid the chlorhexidine scrub because it is too concentrated. Then I would just do the dilute chlorhexidine solution, which is like the blue color. And you would dilute that out the 1 to 40. And then which is better to keep the splint medially or laterally when bandaging? I believe laterally. And I know when I was doing that, I think they also have like a right leg and a left leg split. So yeah, you want to keep that on the outside. Looks like I cut out at one point. Hopefully that was okay. Okay, so yeah, lateral, you want to keep the splint lateral. Will an ideal splint neutralize all forces acting on the bones? So a 4-sided splint, that would be like a cast. Like you can do the casting material all the way around, but they did recommend that you cut it in half on both sides, like not all the way through the leg, but just kind of make a cut on one side and a cut on the other side. So then you can kind of put them together and then bandage around it, just in case you need to get it off quickly if something went wrong. So yeah, you can do a full all the way around. It just may not need that. That would be more if you maybe had a severe injury. So immobilization of spinal and hip injuries. So that is not, you're not really going to have much luck with a splint for probably either one of those. For the hip injury, again, like I said, if it's just dislocated and you've been able to get it back in, or maybe it's just a hip fracture, especially in cats or even their pelvis, you can just cage rest them and keep them really confined and treat their pain. And sometimes they'll heal, especially if it's a young animal. Don't give up on them. Sometimes it's better just to let them heal on their own and keep them really confined than to try to put some kind of splint or bandage around them. Why add insulin? I mean, I don't know the exact mechanism of how the insulin works. So I apologize for that, but I just have used it several times and it really gets nice granulation tissue in there. Probably similar to kind of with the sugar, how it just creates an environment that the tissue, the healthy, good white blood cells want to come in and clean everything up and create more healthy tissue. Okay, explain about Thomas splints and their applications. I'm actually not familiar with a Thomas splint. Okay, please explain SSD insulin application advantages. So again, just if you have a wound that is rather large and you want more granulation tissue to cover the wound, cover the bone, cover tendons, you want that healthy tissue to come in, then you'll use that SSD with the insulin in there. And I typically, those bandages, I mean, you could do a wet to dry first if it's really infected. And then once it looks like the infection's under control, you can do the SSD cream and a bandage and probably change that every 3 days. For how many days would you apply a POP or fiberglass cast in a dog? I didn't really talk about that much, but if there's no wounds to deal with, if you're just dealing with a fracture, a broken bone, then it's probably going to take about 4 to 6 weeks to heal. So that's how long you'd want to do a splint or a cast. How to control excess granulation tissue growth at a wound site. Okay, so that's probably, I don't know if that's referring to horses. I know they have proud flesh. You can just cut that away. You just have to, make sure the animal's comfortable, but you can just remove excessive granulation tissue, especially if it is impeding where the skin needs to come over, because the skin, is trying to cover that granulation tissue. You want it to be flat. So yeah, if you're having like too much, then probably stop the SSD cream and insulin if you're using that, and just kind of cut away so it's flat so the skin can come over that. How often should you change Robert Jones bandage? That is about weekly. Weekly, as long as no bad smell. It wasn't, it looks like the infection has already been under control, and it hasn't slipped or anything like that. What uses of hydrogen peroxide in wound? It's just really not recommended. Maybe if you just had a really slight abrasion, and again, it's not into those deeper tissues, then you could use hydrogen peroxide, but they've just actually found that it's toxic and not good for healing for those deeper layers. What about mag salt glycerin instead of sugar or honey? I have not heard of anything like that, so I would just stick with the sugar. I got so many times fiberglass issues after. Can you explain? I don't know. I'm assuming that's the stuff where you make your own cast, you wet it. I guess I don't. Maybe try to explain a little bit more of what the issues are with that in the chat box, and I'll ask that in a minute. Okay, how to immobilize femur bone fracture with a compound fracture. That would be an extremely hard fracture to splint. in an ideal world, that animal would probably have an external kind of pins and rods where it's like between above and below the comminuted fracture site. It would have like a pin, and it would be coming out, and there would be like an external fixator is what that's called, and there would be another pin. I don't know how you would treat that with a splint. I feel like you might just cause more problems because you're not really going to be able to immobilize that hip joint above the fracture. Okay. Which antibiotics do you prefer to use for infected wounds? It's a great question. If it is an animal bite, clindamycin has been proven to be very good for those. Also amoxicillin with clavuronic acid, it's called Clavamox. Or also Augmentin, I believe, is the human drug that you can use. That's a good antibiotic. And then for the more superficial wounds, you can use, and actually, I mean, even like a laceration or something that maybe wasn't a bite wound. I really like the cephalosporins. So that would be a cephalexin or what is the other one called? Cefpodoxime. That's the other one that we use a lot. And then kind of if it's really infected and looks really bad, sometimes we'll do 2 antibiotics together, like a Clavamox and a fluoroquinolone, like Baytril, which is enrofloxacin, or Zinequin, which is marbofloxacin. How efficient is administering IV antibiotics into the wound before bandaging? I have never done that. I do believe there's some some places do that where they kind of apply a tourniquet and it's supposed to go right in there. But I can't speak to doing that personally. But I know that in some advanced facilities, they do that. Yes. Like sugar, what are your opinions about using turmeric powder directly on wound, as it's also good antiseptic properties? I have never done that. I don't know about that, but if you know other people that have used that and have had success, I would say that you could try that. I mean, we do, after we do the sugar, we also do, you know, after we're done with the sugar bandage and it's healthy, again, I talked about putting ointment on there, a Neosporin, a mupirocin, an SSD, just a basic SSD cream, just to kind of treat it from the outside as well, that infection. Okay, and in which type of fracture would you use a sugar bandage? I would not use a sugar bandage for a fracture because, again, if you're splinting for a fracture, you don't want there to be any wound on the skin, because that means that if there's a wound on the skin, if there's like a laceration and that skin is broken, then likely bacteria has gotten all the way to that bone fracture site, and you're going to have a bone infection, and those are not going to heal well. So I would probably not use a sugar bandage. Now, if you don't have a broken bone and you just have bone exposed, then you could use a sugar bandage to try to, you know, get that healthy granulation tissue in if it's infected. Okay, but it's just when you have infection plus a broken bone, that bone doesn't want to heal very well. So, and also the other point to that is, if you have a wound that's infected, you're going to be changing that bandage daily. And so a splint may not work very well when you're trying to keep the leg still for long periods of time. If you're changing that daily, you know, that could interfere a little bit as well. Can we use a mixture of 0.05% chlorhexidine and 0.1% iodine to flush the wound? I would just choose one or the other. I would probably do the chlorhexidine over the iodine, but I don't think you'd necessarily get any benefit by using both of them. Maybe you could alternate between which one you used if you were going to continue to clean it out, like as you changed the bandage. I guess I didn't talk about that either. If you're doing a bandage change, like say you've already assessed the wound and you treated it and you placed a bandage, and now it's day 2 and you're changing the bandage, you want to remove the old bandage and then re-clean the wound. You don't want to just, leave it be. You could do the hydrotherapy with the straight water. You can do the lavage with chlorhexidine or iodine. You want to get all that slimy stuff off there and kind of get it as fresh as possible before you apply the next bandage. About insulin, it might be insulin is a growth promoting hormone. That's it. Yes, it is a growth promoting hormone. Okay. Does application of topical lidocaine spray or diluted infusion into wound delay wound healing? I am not aware of that. I don't think so, because we actually use lidocaine to not the spray, but just lidocaine to actually inject around incisions and things like that. Whenever we're sometimes maybe the animal can't go under anesthesia because it's too old or it has other problems, and we need to try to address something. We want them to have some relief. We'll do lidocaine. Yeah. How we take decision to remove POP remove it in fracture cases. Maybe just a little, I don't know what POP is. Which bandaging technique is good for femur fracture? Because we can't immobilize the joint above. Really, there's not a good bandage for that. What should be done for fixing vertebral injuries like displacement of axis or atlas? I notice many pups in fights with other dogs. I think just cage rest. I wouldn't, fixing a vertebral injury, that's something that I've never done. If it was maybe just a fracture, then I would just cage rest the dog and let it heal on its own. But we don't do any kind of like neck brace or anything like that. How can we approach when there is a complete open fracture with clean, contaminated or contaminated wound? Yeah, that's a good question. Ideally, again, in an ideal world, this is what they teach us is don't splint these animals, just send them to go get surgery done with probably a plate and a screw, or like they may do an external fixator after they've treated the infection and then treated the wound. But that's in an ideal world. So I think if you really did have a fracture and it's pretty clean, then you would just try to do the best you could with definitely try to treat the infection as best you can with antibiotics. I would be a little more heavy on the antibiotics if the bone is involved. So maybe doing 2 at the same time. And then I would try to get that tissue to heal in over the bone. And then at the same time, you could splint it and try to get that bone to heal back together. Please explain once more about a sugar bandage. So a sugar bandage is for the situation where you have a kind of contaminated wound and you want to treat it and you want to kind of get rid of some of that bacteria. It's probably going to look really goopy and slimy. And so you'll clean it the best of your ability. And then you're just going to pour sugar directly on the wound. Don't make a paste or anything like that. Just pour it directly on the wound. And then you're going to do gauze over that, the soft padding, then the conforming layer, and then the protective outer layer. And you're going to want to change that once a day. Is a splint and bandage both necessary for any fracture, like metatarsal fracture? Please mention if any fracture requires both. So yeah, you wouldn't ever, it's not really recommended to just do a splint like with tape by itself, because I think you'd run into a lot of pressure sores and other issues. And so the bandage with the splint is really just to provide padding for that splint and to keep it in place and to keep it tight and like, you know, immobile so the dog can't move it around. So you would always want to do a splint with the bandage part of it, with the soft padding and the outer layer and the stirrups and everything like that. And then say maybe you had a wound on another part of the leg that away from the splinting part that you're trying, you know, there's no bone exposed, but maybe there's just some, you know, skin abrasions and stuff like that. Say the dog got hit by a car, it's got some road burn, then you could put, you know, some ointment and some gauze on that side of the leg as well. What are the criteria to make decisions to remove a splint applied for stabilization of a fracture? So typically, again, it's going to be 4 to 6 weeks until we typically retake x-rays is what we do to see if that's healed or not. If you weren't able to retake x-rays, I'd probably just do the splinting for 6 weeks. Again, you want to change it weekly, probably. Maybe every other week if they, you know, we're keeping a close eye on the pet and everything, and keeping them confined. And then, so about 6 weeks till that bone is healed. Okay, kindly discuss your line of treatment for a 7-day-old case of terrible myiasis on foreface, including nasal cavity in highly aggressive St. Bernard. I don't know. It would probably very much depend on, I mean, the face, it's really hard to bandage the face. I'd probably just try to treat the dog with oral medication, and maybe the owners could, you know, do some hydrotherapy on it or something like that. But it's really hard when you have aggressive dogs. There is a medication called trazodone that we use here to sedate aggressive animals, or just like kind of take the edge off of them. So you could look into that. The dosage is 5 to 15 milligrams per kilogram of trazodone. How do we approach when there is a complete open fracture with clean, contaminated, or contaminated wound, correcting the fracture or treating the wound? So I kind of talked about that. So I guess, again, in an ideal situation, they would have surgery, but if not, then just do a splint bandage and try to treat the infection. You're gonna have to change it daily, and see if you can treat both. How do I go about bandaging a torn foot pad in a hyperactive dog? I actually have these fairly often. So you can do a paw bandage. And I know I said when you do like the modified Robert Jones, you want to leave the toes exposed, but with a paw bandage, you can't actually go all the way around the toes, but you're only going to go up to about this high on the paw bandage. So I'd probably do that. And then I know if they're hyperactive, maybe use the trazodone, the sedation medication, or just keep the dog confined, crate confined until it's able to heal. With those paw torn foot pads, I do try to like kind of cut away what is not attached, so that way it can heal better. How to bandage sciatic nerve paralysis. So unfortunately, if there's nerve damage, then you're not going to need any bandaging. There's nothing really that can be done, unless I guess there was a wound as well, in which case you would just bandage it like a normal wound. Okay, something about been in a situation in a goat metacarpal fracture where owners couldn't afford implant and it was an open fracture. We needed to flush the infected wound daily, often changing the splint bandage very frequently. How can we promise bone immobilization? I'm not really, I unfortunately don't do any large animal anymore. I mean, obviously we learned about goats and horses and cattle and things like that in vet school. So I can't speak to that exact situation of how to immobilize a goat leg, unfortunately. But I mean, I would probably just think, yeah, do a splint bandage if the goat would allow it, and probably keep it in a really small pen so it couldn't walk around a lot. All right, I think that is pretty much everything. I'll wait another minute or two if any more questions come up, but yeah, this was glad that everybody hopefully learned some things today.